This is a case of a sinonasal squamous cell carcinoma in a 61-year-old male. We received a nasal mucosal biopsy composed of multiple fragments of tissue aggregating 1 cm in maximum dimension. It is to note that the patient had previous chemotherapy done. Here, there are multiple fragments of tissue, some of which are normal respiratory mucosa, others necrotic tissue. To recall, the normal respiratory mucosa is composed of ciliated pseudostratified columnar epithelium with goblet cells, which is well demonstrated here. There's also a background of mixed inflammatory cells within the epithelium as well as within the stroma, which could be related to the previous chemotherapy. Zooming into the necrotic tissue fragments, we see many pinkish ghost outlines of cells without their nuclei. Here are some mixed inflammatory cells. Here we see two fragments of epithelium with contrasting features. On the left side is reactive epithelium, where the cells have relatively smooth nuclear contours, visible but small nuclei. However, on the right side, it is atypical epithelium, where the cells have a disorderly arrangement and they have enlarged, irregular, hyperchromatic nuclei with very prominent nuclei. Zooming into the viable tumor fragments, we see atypical squamous epithelium with a disorderly arrangement of the cells and the cells having enlarged, irregular, hyperchromatic nuclei. Here, there's a keratin pearl formation, suggesting the keratinizing nature of the lesion. And here we see atypical squamous cells with superimposed treatment-related changes, demonstrating very smudgy-looking chromatin. So this case was signed out as mostly detached squamous epithelium with severe nuclear atypia, with a comment that the overall features will favor neoplastic or dysplastic squamous epithelium with superimposed post-neoadjuvant treatment changes.